Hello everyone, I am Dr.Priyanka Sachdev here, NEET PG educator on Unacademy. Today I am here to teach you a very important topic from systemic pathology, that is a topic from cardiovascular system. I will teach you rheumatic fever and rheumatic heart disease today. So this topic is really very important for university exams also, in pathology for second drop, and also for the all competitive exams, MCQs for all competitive exams, that is NEET PG, FMG and INICT. So without wasting time, I am just starting it. It is a type of endocarditis. Now, before starting it, you should know what is endocarditis. Endocarditis, itis. It is the inflammation of the inner layer of the heart, that is endocardium. We know that heart has three layers. So this is the heart, you can see. These are the four chambers of the heart. On the right side, on the left side, the two auricles and two ventricles you can see here. So all the four chambers are in front of you. These are the three layers of the heart you can see here. So the red color one here you can see is endocardium. The black color one here you can see is myocardium, and the outermost blue color one is pericardium. So endocardium, myocardium and pericardium. These are the walls of the heart. That is mitral wall and tricuspid wall. Mitral wall on the left side, tricuspid wall. Now walls are made up of only endocardium. So walls are made up of only endocardium. So endocardium is basically of two types. The endocardium which is present over the wall. The endocardium which is present over the wall is known as valvular endocardium, and the endocardium which is present over rest of the heart, is known as mural endocardium. So you can see valvular endocardium and mural endocardium. After the endocardium, you can see the black colored layer is myocardium, and after it the outermost layer is pericardium, the outermost. So these are the three layers. So inflammation of the innermost layer of the heart, that is endocardium, that is both type of endocardium, mural as well as valvular, is known as endocarditis. Now these are the types of endocarditis. The most important type of endocarditis which I am going to discuss in detail today is rheumatic endocarditis. So here I will discuss rheumatic fever and rheumatic endocarditis basically. And there are three other endocarditis which are known as non-rheumatic endocarditis. So in non-rheumatic endocarditis, it is of three types. So one is rheumatic, the most important one is rheumatic, and non-rheumatic are three types. You can see the name three types. The rheumatic and the endocarditis which occurs in SLE is known as Liebmann-Seck endocarditis. The second is NBTE, non-bacterial thrombotic endocarditis. And the last one is infective or bacterial endocarditis. Infective or bacterial. So I am starting with the first type of endocarditis, that is rheumatic endocarditis. So here I will not discuss only endocarditis. I will discuss entire rheumatic fever and rheumatic heart disease. So let me start. So is there any difference between the two terms, rheumatic fever and rheumatic heart disease? Yes. Rheumatic fever is the umbrella term containing five terminologies, containing five diseases. Rheumatic heart disease is one of them. So I can say rheumatic heart disease is a part of rheumatic fever. Let me explain you what it is. See, I will explain rheumatic fever to you in all these headings. I will take them one by one. Listen, you can see a child here. Can you see? It mostly occurs in child 3 to 5 years of age. Rheumatic fever I am talking about. So you can see a child here. Let me highlight it. You can see a child. This is the child. These are the pharynx or tonsils of the child. So child got tonsillitis or pharyngitis by a bacteria known as group A beta streptococcus bacteria. So group A beta streptococcus pharyngitis, it is very common. So most common bacterial cause of pharyngitis or tonsillitis is this only. So group A beta streptococcal pharyngitis. So what will happen? The body of the child will form antibodies against it. You can see the Y-shaped antibodies. These are formed in the blood of the child. So these antibodies will bind with the antigen present on the surface, and antigen antibody complexes are formed, and bacteria will be killed, will be phagocytized. Phagocytosis will occur and bacteria will be killed. So what is the problem here? Actually the problem is with the antibodies. These antibodies act as autoantibodies. Actually what is happening now, listen what is happening. The antigen which is present over the bacteria, similar antigen is present on 5 organs of the body of this boy. One is heart, second is brain, third is skin. So third one is skin, you can see. And fourth is just tissue behind the skin, beneath the skin, that is subcutaneous tissue, the tissue beneath the skin. And last is joints. You can say any joints. So joints, the last is joint. So brain, heart, skin, subcutaneous tissue and joints. So these 5 organs contains antigen which are similar, which are almost similar, which are mimicking the antigen on the bacteria. So these antibodies will get confused. So they will cross react. So they will kill the bacteria. They will kill the bacteria. Bacteria is causing no harm. But these antibodies, can you see? These are coming and binding with these 5 organs. Antigens present on these 5 organs causing 5 diseases in the 5 organs. Name 5 diseases. The disease which occurs in heart is known as rheumatic heart disease due to antigen antibody complex. Rheumatic heart disease. The disease which occurs brain is chorea. Sydenhamschorea. Chorea. The disease which occurs in skin is erythema marginatum. Erythema marginatum. The disease which occurs in subcutaneous nodules is subcutaneous tissues, subcutaneous nodules. And the disease which occurs in joints is migratory polyarthritis. So these are the 5 diseases: rheumatic heart disease, sydenhamschorea, erythema marginatum, subcutaneous nodules, and migratory polyarthritis. So these 5 diseases together known as rheumatic fever. So rheumatic fever is the umbrella term containing these 5 diseases together. I hope it is clear to you. Now, is it clear to you? The disease is not caused by the bacteria. Rheumatic fever is not caused by the bacteria. Rheumatic fever is caused by body's own immunity, own autoantibodies due to molecular mimicry and cross reactivity. So molecular mimicry is shown by these 5 tissues, showing a mimicry of the antigen with that of bacteria. So that is known as molecular mimicry, and cross reactivity is the antibodies reacting with these 5 organs. So that was about the introduction. So let's see, in the theory it is written. So can I say what is rheumatic fever? It is a multi-systemic disease involving 5 systems, that is CNS, brain, cardiovascular, heart, skin, subcutaneous tissue, and joints. So these are the 5 systems involved in the disease. It is a post-streptococcal. Always first bacteria will come, then rheumatic fever will occur. So it is post-streptococcal, non-suppurative disease. It is not caused by pus. It is not caused by bacteria. It is an autoimmune disease involving 5 organs. You know the name of the 5 organs. They are written in front of you. So it is an acute immunogenically mediated disease. It is due to body's own antibodies, and it is multi-system involving 5 systems that occurs a few weeks following the episode of group A beta streptococcal pharyngitis. So that was the introduction. Pathogenesis, it is an autoimmune diseases. It is not caused by the bacteria. Please remember, bacteria nahi kar raha kuch bhi. It is caused by body's own antibodies. So there is a susceptible host, which is a child usually. So group A beta streptococcal pharyngitis is occurring to the child. Antibodies are formed. These antibodies are acting as autoantibodies. So they will kill body's own tissue, the 5 tissues, and it will cross react with the body's own tissue, host own tissue, and it will cause that is rheumatic heart fever, the 5 diseases. So what is the name of the antigen on these 5 organs, that is brain, heart, skin, subcutaneous tissue, and bones? What is the name of that antigen which is mimicking the antigen of that bacteria, epitope of the bacteria? The name of the antigen is NAG, that is N-acetylglucosamine. Again, a very important MCQ, NAG, N-acetylglucosamine. Done. So here, can you see the black colored antigen? Here I have marked the name of this antigen. The name of this antigen which is mimicking the antigens on this bacteria, the black colored. So I have used the same color, showing that it is the same antigen. So the name of this antigen is N-acetylglucosamine, NAG. I hope you like it. So can I say molecular mimicry and cross reactivity is the basic fundamental pathology which is occurring in rheumatic fever? Yes, molecular mimicry means these 5 organs, they are mimicking in terms of antigen with that of antigen on the bacteria. So mimicry is there. And because of this mimicry, the antibodies are doing cross reaction. Instead of binding with bacteria, the antibodies are binding with these 5 organs. I hope you got it. You like the concept. Now coming on the Jones criteria. Jones is a person, a scientist who has given criteria for identifying rheumatic fever. So for rheumatic fever, you are a doctor. A child is coming in your clinic. The parents are carrying their child to your clinic. So what symptoms or what things you will find in the child before giving a diagnosis of rheumatic fever? So there are 5 major criteria, there are 5 minor criteria, and there are 3 other criteria, supportive criteria. So total you can say 13 criteria are there. So these supportive are in revised criteria. Initially only 5 major and 5 minor criteria were there. Let me tell you the 5 major. The 5 major criteria are same, the 5 diseases in the 5 organs. So in the heart, it is rheumatic heart disease or carditis. In the joints, it is migratory polyarthritis. In the brain, it is sydenhamschorea. In the skin, it is erythema marginatum. And in the subcutaneous tissue, it is subcutaneous nodules. So these are the 5 major criteria. 1, 2, 3, 4, 5. So name of 5 diseases in the 5 organs is the 5 major criteria of Jones. If you want a mnemonic of it, the mnemonic is in front of you. See child. This is the tonsils of the child. See inside the tonsils, pus is filled. It is the infection of group A. Beta streptococcus pharyngitis is there, and antibodies which are formed against these bacteria, those antibodies are cross-reacting with the 5 organs, causing these 5 criteria. So mnemonic is Jones only. The mnemonic is Jones. Jones, Jones. J stands for joints, polyarthritis. O को heart बना दो, make a heart out of O. So that is carditis, pancreatitis. N for nodules, subcutaneous nodules. E for erythema marginatum, and S for sydenhamschorea in the brain. So this is a mnemonic if you want the mnemonic. These are the 5 major. Now coming on minor criteria. What are the 5 minor criteria? So child will have a fever now. When the child is having pharyngitis by group A beta streptococcus bacteria, he will have fever. The child will have fever. So fever is a minor criteria. Please mind it. Arthralgia. Please mind it. Arthralgia is a minor criteria, but arthritis, polyarthritis, migratory polyarthritis. Arthritis is a major criteria. There is a difference between arthralgia and arthritis. Please, being specific. Arthralgia means pain in the joint, and arthritis means inflammation in the joint. Inflammation in the joint. So pain in the joint is a minor criteria, but inflammation in the joints is a major criteria. Don't get confused. You will definitely get many of these MCQs confusing between major and minor criteria of Jones. So इसमें बार-बार ये option में आएगा arthralgia and arthritis. Don't get confused. Arthralgia, minor criteria. Arthritis, major criteria. A previous history of rheumatic fever is a minor criteria, and there are 3 lab findings which got elevated. ESR, you know, erythrocyte sedimentation rate will be elevated. C-reactive protein will be elevated, and WBC count will be elevated. So these 3 findings, and PQRST waves in ECG. So there will be prolonged PR interval. So let me enumerate the minor criteria. So what are the minor criteria? What are the major? 5 major, who will tell me? And what are the minor? 5 minor, who will tell me? Can you help me in revising it? Someone among you. So the major criteria are the 5 organs. So in the brain, it is sydenhamschorea. In the heart, it is carditis or rheumatic heart disease, one and the same thing. In the skin, it is erythema marginatum, subcutaneous nodules and subcutaneous tissue, and migratory polyarthritis. Migratory polyarthritis in the joints. Coming on minor criteria, it is fever to the child, then increase ESR, increase C-reactive protein, and increase WBC count, leukocytosis, and increase PR interval on ECG, and previous past history of rheumatic fever, and arthralgia, not arthritis, arthralgia. These are the 5. 1, 2, these are the lab findings all included in 1. 3, 4, 5. 5 minor, 5 major, 5 minor, without any confusion. Please learn it. You can't imagine how many MCQs you will get on it. So the 5 major criteria are written in front of you. The 5 minor criteria are written in front of you. Done. So these are the 5 major in front of you. These are the 5 minor in front of you. I have already told you. Now nowadays we are using revised Jones criteria, not Jones criteria, but revised Jones criteria. So what is the revision? In it, we are including supportive criteria also. So 3 supportive. Supportive means group A streptococcal criteria. Now, if a child is, now you are a doctor, you are sitting in your OPD. If any child is coming to you with these major and these minor, but child is not giving a history of past streptococcal infection, would you say it is a rheumatic fever? No. For rheumatic fever, past throat infection or pharyngitis or tonsillitis by group A streptococcal infection is a must. उसके बाद होगा तभी you will say it is rheumatic fever. अगर उसके बिना होगा तो you can't say it is a rheumatic fever. So these are the supportive criteria known as GAS. GAS means group A streptococcal infection criteria. So first confirm child is having an infection. So always ask the mother whether 15 or 20 days back the child is having an infection of group A beta streptococcal or child is having tonsillitis. If yes, it is confirmed. So do a throat swab of the child, number 1. Either you will do a throat swab like we do for the COVID nowadays. So throat swab number 1. So that will be confirmed bacteria is present in the throat or not, in the tonsils or not. Number 2, take the blood sample of the child and see antibodies against the bacteria. So which antibodies you will see? 2 types of antibodies, anti-streptolysin O and anti-DNase. So these 2 antibodies, remember. So 5 major, 5 minor. 1 second. So 5 major, 5 minor, and 3 supportive or 3 group A streptococcal gas criteria. So इनमें से how many you will find in a child? So you will quote the child is having rheumatic fever. All 13 cannot be present in a single person, no? So how many? So either 2 major are present. Out of 5 major, 2 major are present. So you will say the child is having a rheumatic fever. If not 2 major, if out of the 5 major only 1 major is present, anyone can be present. Either rheumatic heart disease or carditis or erythema marginatum, anyone can be present. Along with 2 minor, at least 2 minor तो होने चाहिए. उससे ज्यादा होगा तो it's good, but at least 2 minor. So you will say along with it, in दोनों में ही, along with one of the gas criteria. One of the gas criteria should be present. That is supportive criteria indicating past infection of group A streptococcus. Then you will say the child is having rheumatic fever. So either 2 major or 1 major plus 2 minor along with preceding infection of group A beta streptococcus bacteria. So that was all about it. Now from these 5, first I am discussing the first one, the first major criteria. I will discuss all 5. I am discussing first one now. That is rheumatic heart disease. In rheumatic heart disease, there is pericarditis. What do you mean by pericarditis? As I have told you, heart has 3 layers: endometrium, endocardium, myocardium, and pericardium. Inflammation of all 3 layers together is known as pen. Pen means all. Carditis. Pericarditis. So in rheumatic heart disease, all 3 layers are involved: endocarditis, myocarditis, pericarditis. That's why it is known as pericarditis. Pen means all. Pericarditis. Please remember it. Pen. So we will talk about them one by one. The 3 layers we will take. So endocarditis, the first layer; myocarditis, the second layer; pericarditis, the third layer. Say yes or no. So endocardium is of 2 types, as I have told you: valvular endocardium and mural endocardium. Yes or no? I have told you. Valvular is present over the walls. Valvular is present over the walls, and mural is present in rest of the heart. Mural endocarditis. So endocarditis, I will divide endocarditis into 2 parts: valvular endocarditis and mural endocarditis. Let's talk about them one by one. Let's take the first one, valvular endocarditis. In valvular endocarditis, there are vegetations or verrucae are formed on the wall. Can you see the walls? The 2 walls here. Say yes or no. Can you see small nodules, yellow colored nodules over these walls? These are known as vegetations. These are known as vegetations or verrucae. So these are vegetations. So can you see here? I am marking it. Can you see the small yellow colored dots present on the walls? That is verrucae and vegetations. Can you see? See the first diagram, rheumatic heart disease. These are the rest 3 endocarditis. I am teaching you the first one, rheumatic. These 3 are non-rheumatic endocarditis. So can you see the small nodules are there on the walls? So these are verrucae. See, this is a diagram from Robbins. You can see the vegetations beautifully depicted here. So describe the vegetations. All of them are small, 1 to 3 millimeter. They are multiple. They are warty, soft to firm, and these are sterile or bland, because the vegetations here, these vegetations are not caused by bacteria. Bacteria is not coming and causing these vegetations. Actually, these are caused by antibodies. That's why there is no bacteria inside these. So it is sterile. These vegetations are sterile. These are caused by antigen-antibody reaction. Antigen is the own tissue, that is NAG, N-acetyl glycosamine. It is not bacteria. Which walls are involved? We know heart has 4 walls: mitral wall, tricuspid wall, aortic wall, and pulmonary wall. So this is the sequence. So most commonly mitral wall is involved, followed by aortic, followed by tricuspid, followed by pulmonary. So first on left side, then on right side. So most common mitral, followed by aortic, followed by tricuspid, and pulmonary is least commonly involved. Please learn it. So these vegetations are formed. So what is the location over the wall where these vegetations are formed? So just imagine, okay, it is difficult. I will try. So can you see, this is a heart. These are the 4 chambers of the heart. This is the left side. Okay, so here on the left side, this is the mitral wall. This is one leaflet. This is another leaflet. It is a bicuspid wall. So these are the 2 leaflets of mitral wall. These are the mitral. So over mitral wall, where the vegetations are formed. So imagine, see, this is atria, this is ventricle, and these are the 2 leaflets between atria and ventricle. Atria, ventricle. These are the 2 leaflets. So they open, they close, they open, they close. So blood flows from atria to ventricle. Yes or no? So these are the 2 leaflets. So over the leaflets, they are formed at the junction of the 2 leaflets. I am drawing here on my hands just to show you where they are formed. Can you see the dots? Yes, they are at the junction of the closure. So they are not on the above surface. They are not on the below surface on the leaflets. They are present at the junction. This is known as line of closure. So they are present on the junction or line of closure. I hope you like it and I hope you got it. So what is the location? So the location is, what happened? Okay. The location is along the line of closure of the leaflets. Done. And what is the deformity? Last thing, what is the deformity here? The wall will get deformed. Because of the formation of these vegetations, the wall will get deformed, and the deformity is known as fish mouth or buttonhole. See, because of, can you see? This is one leaflet, this is another leaflet, and these are the vegetations over the leaflets at the junction. And because of this vegetation, it is looking like a fish mouth. It is looking like a fish mouth. So fish mouth, can you see? A fish mouth. These are the vegetations. Can you see the vegetations? Beautifully depicted. All diagrams from Robbins. You can see it is fish mouth. Can you see again? It is fish mouth. Give me a thumbs up if you like it. Fish mouth or buttonhole deformity. So all about vegetations. Summarize vegetations. These are small, multiple, sterile. Number one. And the most common wall is involved is mitral, aortic, tricuspid, pulmonary. That is the sequence where they are formed at the line of junction or line of closure. And what is the deformity? Fish mouth or buttonhole. That was all about vegetations. So valvular endocardium is over. Coming on mural endocardium. What is mural endocardium? Apart from walls, the else all where endocardium is known as mural. So heart is like a 3D structure. So the innermost layer is endocardium, then myocardium, then pericardium. So endocardium mein apart from walls, the rest of the heart over the mural endocardium is known as mural endocardium. So in that a patch is formed. In that endocardium a patch is formed. That patch is known as McCallum patch. So where the patch is present, we know heart has 4 chambers, 2 auricles and 2 ventricles. So it is formed in left auricle. Please learn it. I have drawn in the diagram very beautifully. It is seen there. It is in left auricle. The left side, left auricle, just above mitral wall. Posterior leaflet of mitral wall on the posterior surface of the heart. Posterior surface of the heart. So that is McCallum patch. You can see here. You can see here. So that is McCallum patch. So that was all about endocarditis. The 2 types of endocarditis. Over the walls, vegetations are formed. Say everything about vegetations. Over the mural, McCallum patch is formed in the left auricle, just above the mitral wall on the posterior surface, just above the posterior leaflet. Coming on myocardium, the second layer myocardium. So in the myocardium, can you see the black colored myocardium? Can you see the 2 things in the endocardium? Over the walls, vegetations are formed. Over the mural endocardium, McCallum patch is formed. So endocardium is over. Now coming on myocardium, see the middle layer, the black colored layer. I have drawn multiple small circular structures, nodular structures in myocardium also. These circular structures here are known as ashcoffnodules. So multiple ashcoffnodules are formed in myocardium. So what is ashcoffnodule? So ashcoffnodule is basically a granuloma. These all ashcoffnodules present in the myocardium. That is the pathogmatic. Please write it down. Very important. Pathogmatic feature of rheumatic fever or rheumatic heart disease. So it is not seen in any other disease in this world. So it is present only in rheumatic heart disease. It is pathogmatic feature. So out of all these features, it is the pathogmatic feature. Number 1. And what are these ashcoffnodules? These are granuloma. Do you know what is granuloma? Yes. So let me zoom it out one of the diagrams. So can you see this is the ashcoffnodule? So I am zooming it out. See the structure of one of the structure. All of them are same. So I am drawing structure of one of them. So in one of them, see at the center necrosis is there. Here is the necrosis. So here I am rubbing it. Just a second. Can you see? I have shown the necrosis with yellow color here. So I have shown the necrosis here. Just a second. Okay, I have shown the necrosis here with yellow color. This necrosis is fibrinoid. You know the 5 type of necrosis. So what are the 5 type of necrosis? So it is coagulative necrosis, caseous necrosis, liquefactive necrosis, fat necrosis, and fibrinoid. So here it is fibrinoid, the last one. Fibrinoid necrosis. Please learn it. Har point pe MCQ hai. So fibrinoid necrosis is there in the center. Surrounding that necrosis, 2 types of cells are present. The red colored one here, multinuclear red cells. Can you see? These are known as Ashcoff cells. These multinuclear red cells are known as Ashcoff cells. And the green colored cells here you can see. The nucleus is like caterpillar. The nucleus is like a caterpillar, or the nucleus is like owl eye. Ullu ki aankhein caterpillar. These green colored cells are anti-Ashcoff cells. So Ashcoff and anti-Ashcoff cells are there surrounding it. So, and in the center, there is fibrinoid necrosis, and surrounding it, some more cells are present, that is lymphocytes, plasma cells, and fibrocytes. You can fibroblast. So, these are the lymphocytes, plasma cells, and fibrocytes. So, total 5 cells are present. So, that is the structure of Ashcoff body. So, in the center, you can see there is fibrinoid necrosis surrounded by anti-Ashcoff and Ashcoff cells, surrounded by lymphocytes, plasma cells, and fibroblasts. There are no neutrophils in Ashcoff body, and Ashcoff bodies are granulomas. So this is the diagram. So can you see in the center, this is fibrinoid necrosis. Can you see this multinucleated cell I'm marking here? It is Ashcoff cell. Can you see this cell? This cell. So see this cell, if you see it longitudinally and transversely. If you see it longitudinally, the nucleus is caterpillar-like. If you see it transversely, the nucleus is owl-like. So these cells are known as anti-Ashcoff. So what are Ashcoff and anti-Ashcoff cells? Ashcoff and anti-Ashcoff, both of them are macrophages, modified macrophages. Ashcoff cells is multinucleated giant cell. Anti-Ashcoff is having caterpillar or owl-like appearance. That is the thing. So here you can see which cell is this I'm marking with red. Please see it. Which cell? It is multinucleated giant cell. That's why Ashcoff. And which cell is this? I'm marking this one, these two cells. So can you see? It is caterpillar-like. It is owl-like. So this is longitudinal view. This is transverse view. So these two are anti-Ashcoff cells. So that was all about it. And coming on the third thing now, pericardium. So myocardium में Ashcoff bodies होती हैं, endocardium में vegetations and McCallum patch होता है. Coming on pericardium. So what is pericardium? The outermost layer, the green colored layer you can see here is pericardium. So between myocardium and pericardium, normally a thin watery fluid is present inside normal heart, my heart, your heart. So normal heart, thin watery fluid is present. This fluid will become thready. I have drawn threads. This pericardial fluid become thready. It is known as fibrinous. Fibrinous means thready, threadiness. So it is known as fibrinous pericarditis. So in pericardium, the pericardial fluid will become thready, धागे के जैसा हो जाएगा. It is known as fibrinous pericarditis. So what will happen if I cut it? If just suppose the child is dead because of the disease, rheumatic fever, and I am doing the autopsy of the child. I am taking the heart out. Can you see? This is the heart. I am taking the heart out. In the heart, here, this is the pericardium, and this is the myocardium. So when I'm cutting with the scissor, I'm separating the pericardium from the myocardium. So what I'm seeing bread and butter appearance. What do you mean by bread and butter? These are the two slices of bread. In the sandwich, there is a butter in between. There is a butter in between. So if you are separating the two slices of bread with a butter in between, you will see the threads. So it is the thready with that appearance that is known as bread and butter. So please appreciate the threads I'm marking here. Can you see the threads here? Zoom the image. See the threads. So it is bread and butter appearance. So finally, what we have learned today, we have learned this thing. What we have learned? We have learned pancarditis in rheumatic heart disease, endocarditis, myocarditis, pericarditis. In endocarditis, in valvular endocarditis, there are vegetations formed. You know on which walls, where, what is the deformity. In mural endocarditis, it is McCallum patch. You know in which chamber and which wall. In myocarditis, Ashcoff bodies are formed. You know what are these? These are granulomas, and what is the composition, which type of cells are present. And in pericarditis, there is fibrinous pericarditis, that is bread and butter appearance. Give me a thumbs up if you like the concept. So give me a thumbs up if you like the concept. And among all these, the pathogmatic feature is Ashcoff bodies. Don't forget. So I am done. Out of the 5, I am done with the first one, rheumatic heart disease. I am done. So thank you very much. Now what about the others? If you want to learn about sydenhamschorea, erythema marginatum, subcutaneous nodules, and migratory polyarthritis, then rheumatic fever is complete. Still rheumatic fever is incomplete. I have taught you only one among the 5 Jones criteria. So if you want to learn all 4 and after rheumatic fever, this is one of the endocarditis. There are 3 more other non-rheumatic endocarditis. If you want to learn for them, that is Liebman-Sachs, NBTE, and bacterial infective endocarditis, what you have to do? I have taken these lectures for free, but not on YouTube. I have taken these lectures, that is non-rheumatic endocarditis and the remaining 4 Jones criteria, and all about CVS, other topics also, myocardial infarction, angina, many important topics. All of them are available for free on Unacademy Learners app. So what actually you have to do? Just go to the Play Store. From the Play Store, install Unacademy Learners app on your mobile, and just go under NEET PG category as a goal. Select goal as NEET PG. There are 2 types of classes, free and paid. The free classes are known as special classes. So go under free classes, go under special classes, and search my name. My name is Dr. Priyanka Sachdev. Dr. Priyanka Sachdev. You will get my profile link there. Just follow my profile link. You will get all my recordings for free. But for opening the recordings, you will require a code. So the code is Sachdev10. My name, my surname, SACHDEV, Sachdev10. It's not Sachdeva. It's Sachdev10. So just go, install the app, go NEET PG category, go under free classes and search my name, Dr. Priyanka Sachdev. Follow my profile link and just unlock my classes. So it is available for free. So you will have a better experience than YouTube there. Why? The classes, special classes, there also they are free. On YouTube, they are also free. Why? You will have a better experience there on special classes. Though these are more interactive as compared to YouTube classes. There is a poll option. I will ask a question in the form of the MCQ and you will get 4 options to click. And you will you will know your real time rank. What is your rank from all the candidates who are attending the class or who have watched the lectures. So there is a poll option, there is a raise a hand option. You can do raise a hand and send your voice message to me in the form of the questions. You will never miss special class. You will always get notification 10 minutes before the class. You will get notes there. So if you want the notes of this rheumatic heart disease, come there. PDF is available for free. So just download the notes and with annotations, without annotations, it is available. That was for free. That was for free. And there is paid subscription also on the platform if you wish to take. Let me tell you the important points about the paid subscription. Paid subscription is of 2 types, Plus and Iconic. In Plus, you will get access of live as well as recorded classes. India's topmost educator will teach you. One of them is me and we have a team and all 19 subjects will be covered. There are live tests, live quizzes. You will get printed notes. You will get more than 25,000 questions, clinical as well as image-based new questions. For the NEET PG, FMG, INICT, and in Iconic subscription, the second type of paid, along with Unacademy, you will also get access for the prep ladder recorded lectures. So better to go with Iconic. You can go with Plus also if you wish. Yeah, I am coming on Plus platform. On Plus platform, I am going to come in a new batch which is going to launch on 18th of this August, this month, 2021. 18th August 2021. The name of the batch is Target Next. So I request all the next aspirants who are going to target next 2022-2023. So please join this batch. Here, what is the specialty of this batch? We will not teach you in a conventional way subject wise. So we are not going to teach you. We will teach you all 19 subjects, but not subject wise. We will teach you system wise in an integrated way. So we will teach you system wise. What do you mean by system wise? So this month I am teaching CVS. So CVS first we will cover from anatomy. We will teach anatomy of the CVS to you. Then we will teach the embryology, embryogenesis of heart, physiology, the cardiac cycle. Pathology portion will be taught by me. CVS, the entire pathology. This was only a trailer. The complete movie will be shown there. So pathology mein MI, angina, cardiomyopathies, pericarditis, myocarditis, and all the endocarditis, all rheumatic heart disease, the complete portion, and heart failure. Many other topics also. So complete CVS, yeah, congenital heart diseases, valvular heart diseases, complete will be taught by me in pathology. Then in pharmacology, we will teach you anti-heart failure drugs, all the drugs in pharma. Then in medicine, all important portions in medicine. Then in surgery, then pediatrics. So we will teach CVS from all 19 subjects wherever applicable. The next month, we will take another system, that is RESPI. In the similar way, we will cover RESPI. So then we will take 7 major systems one by one every month. And in this way, we will prepare you for all 19 subjects for the integrated questions, which is the main approach for next. So now NEET PG, FMG, INICT nahi hogi. Next year, so there will be next. So if you are a next aspirant, this is your strategy to study. So most of the students always ask me, ma'am, next aa raha hai, kaise tayari kare? We are in second prop, we are in third prop, hame NEET PG nahi dena hai, hame NEET next dena hai. So this is the way to study. So please join. Please take the subscription, join our Plus or Iconic platform and take the advantage of this batch. This batch is coming from 18th of August. So if you are taking the subscription, planning to take it before 18th. 18th will be my first lecture. 18th se hi anatomy, physiology, pathology, all will be started together. Biochemistry, yes. So we will take CVS from microbiology also. You will take it from all 19 subjects wherever applicable. So take the subscription before 18th and the batch will last for 6 months. Done. So please take advantage of it. Please take. I request you. And these are the other batches available on Plus platform. So you can see it is for FMG students for next 2022 for NEET PG ultra fast track revision, NEET PG test and analysis. There is a NEET PG 1 month package also. In NEET PG only 20-25 days are remaining. 2021. It is on 11th of September. So for this there is a package which costs only 4,500 rupees. Only 4,000. And if you apply this code Sachdev 10 SACHDEV Sachdev 10 on this before payment, you will get additional 10% off. So don't forget the code. The code is Sachdev 10. So apply it and take the advantage of last few days in the preparation of NEET PG and assure your selection. Do you want it for free? Do you want this package, my batch, these batches, target next, iconic subscription plus? Do you want it for free? Yes, there is a chance for you to win it for free. Give the scholarship test. I have curated 50 questions from systemic pathology for you. And I'm going to conduct a scholarship test for you people. Please appear in the scholarship test. It is going to happen on next Sunday. That is 22nd of August, 11 a.m. in the morning. The questions are curated by me. The questions are tough. I'm announcing it. The questions are tough, but specifically only from the systemic. It is not from general, it is not from hematology, it is from systemic pathology. So the portion is small. So watch all my free lectures. All questions are from my lectures only, not out of the syllabus, but questions are tough. They are new, though they are not repeat ones. So you will 3-month Unacademy free plus subscription. The winners will get. So please mark it, and the link is available on the app. Please enroll and give it and try your luck now. At least try it out. And okay. 2 more offers are available. If you are taking 1 year subscription on Unacademy, you will get 2 months extra. And if you are taking plus subscription or iconic subscription for 4 years, this is our cheapest plan. If you are a first prof student or second prof, now go for this plan. So it is the cheapest. It costs only 60,000 or 70,000 for whole 4 years. And you can convert it into monthly installments also, which is very cost effective and very reasonable. Only 1100 or 1400 per month. And apart from 4 years, these are other plans available on the app. So plans start from 3 months, 6 months, 12 months, 18 months till 4 years, or iconic it is starting from 12 months. So longer the duration of the plan, cheaper it is. So you can see, go for a longer plan. Otherwise 1 month package is also available. The code is Sachdev 10. Please apply this code before any plan you are taking. You will get additional 10% discount applied before payment. So it is SACHDEV, and unlock my free classes using this code. You can ask a doubt to us. Take the snapshot of the doubt and post to us under Ask a Doubt category. There is a NEET PG. Let's Track NEET PG Telegram channel also. Please join it for getting notification. Follow my profile link on Unacademy. Thank you. See you. Bye-bye.